Hello everyone, welcome to our channel Physiomax Educational Hub. Myself Dr. Tapas Kumar Pal, and we will be learning today one most important radiological findings, that is about this occipital spur. So our today's learning topic is occipital spur and its correlation with the headache. What is exactly this occipital spur is? Occipital spur, it's also called as a occipital knob or the occipital bun, which is also named as a chignon or the Indian hook. What is exactly is this? It's the exaggerated external occipital protuberance. Where exactly this is present? This is present just over here near the inferior nuchal line over the temporal bone. Now, as per the anatomy, from this particular region, there is a group of muscles which is to present. Mainly, in this region, we are having the insertion of the sternocleidomastoid muscle, and just side of it, we are having one more important muscle, that's the splenius capitis muscle. So here we are having the sternocleidomastoid, and here we are having the splenius capitis. Except of that, also we are having two more important muscle, that is the semispinalis capitis and longissimus capitis over here. And in this region, one more important nerve which is to pass, that's the greater and the lesser occipital nerve. Now the problem is, few of the people, either it can be a congenital or just because of the tightness of this particular deep neck extension and the sternocleidomastoid muscle, there is a abnormal growth of this occipital spur or the occipital knob. Now, what exactly happens when this occipital spur or the occipital knob is to grow? This will make a abnormal tension over this particular two muscle, that's the sternocleidomastoid and splenius capitis, and that result in the tightness of these two muscles. And once these two muscles will be tight, that will make the pressure over the nerve which is to pass in between this lateral intermuscular gap, that's the inferior occipital nerve or the lesser occipital nerve. That resulted a painful spasm over this region, that's a deep extension region, and as the nerve is to get compressed, that leads the pain to get radiated towards the head. And this condition, sometimes it is misdiagnosed with cervical spondylosis, and that's the reason we need to understand, that's the reason we need to have a clear X-ray understanding or the clear radiological understanding of this occipital spur. Now the question comes, what exactly this occipital spur does when it is to get enlarged? It is to get enlarged and it is to make the tension over these muscles, and that result in the nerve ultimately to get compressed, and that used to make the radiating pain towards the head. So those who are watching this video, so for them it's important to know that each headache or the each neck pain, it's not the cervical spondylosis. This is also a very common condition, and a lot of patients used to get with this occipital spur or this occipital bun is to make a lot of tension over the deep neck extensor muscles including the SCM, and that ultimately leads to have a neck and the pain which is to radiate towards your head. So That's the one important clinical condition we learned today. That's what is called as a abnormal growth of the occipital spur by the radiological findings. Thank you everyone. So hopefully all of you learned one more important topic from our channel. So those who are watching this video, those who yet not subscribed this channel, I request everyone to subscribe to learn most of the common conditions related to the orthopedic, and will bring you all the latest evidence-based clinical conditions and the clinical treatments in the field of rehabilitation and physiotherapy. Thank you everyone.